I'm going to start by saying just wow, like this morning has been better than I ever kind of imagined. It's just really been amazing. It's really a pleasure for me to introduce Dr. Ted Teknos. When Dr. Teknos walks into a room, or like you're at a meeting and he walks up, or you're sitting around talking about like famous alumni and his name comes up, it's almost immediately followed by, Ted! That guy's amazing. I love that guy. Those kind of responses only happen for somebody who has deep connections to people. And so I want to tell you a little about my connection to Ted. It started in my fellowship, and as you can imagine, it started with stories. It started about stories of like mass ioneer, emergency room chaos, especially after the Green Day concert on the Esplanade, that one 4th of July. I see some heads shaking, yes. It included resident stories about being at the Ioneer, looking over the jail, watching inmates try to escape, stories about the Sevens down Charles Street, and impersonations. Ted's impersonations of faculty that are near and dear to all of us made immediate bonding for us. That was a pretty easy connection, but my real connections for Ted came over the next year, and they really impacted who I became. As a caregiver, we were in clinic one day, and we're seeing a very typical head and neck patient, kind of an old curmudgeon-y guy, and Ted goes, so how are your spirits? And I'm like, that's kind of a weird question. That question opened up a half-hour discussion about depression, and man, this journey this patient had been on, that changed who I became as a provider. As an educator, would you be sitting at the microscope and all of a sudden you'd hear, some of the residents are laughing. So he wouldn't yell at you like, hey, that could be better. He just kind of sighed. And I very much appreciated not being yelled at, which was great. I have either subconsciously or consciously picked that up in my educational methods. But a few years later, I started to realize how often I was taking a deep breath, but not sighing. And I realized that Ted must have been taking a lot of deep breaths with me, but there were only a few sighs, which meant he gave me space to learn with him at my side. And that was amazing. So it changed who I became as an educator. And then a few years later, I actually interviewed for a job with Ted, and I didn't get it. And let's be honest, this is a safe space. There might be some mass ioneer nepotism that happens sometimes, I don't know. But the conversation we had around that showed me what honest, straightforward friendship and leadership is, and I'm striving for that. This is how you make connections so that when you walk in the room, people are like, Ted! It's amazing, and that's what this place really brings. And so, based on the title of this talk, I think we're going to have 15 minutes of amazing stories from Ted Teknos, and I can predict that at the end of that, we will all feel more connected.
Well, that introduction, Kevin, was amazing, and I'm sorry I'll probably let you down. But it truly is an incredible honor to be here. I mean, this institution means so much to me. And listening to the people who spoke already, it's intimidating. It's intimidating to have to follow, artists and brilliant scientists and brilliant people. And next is Ralph Metzen, who we all know can turn a tale better than anybody. So I'll try to keep this brief. But when I was thinking about what to talk about, I didn't really know what to say or what to do. So I reflected back on when I was trying to decide about my residency program. And I had done general surgery at MGH. I actually really thought I was going to become a general surgeon. Charlie McCabe, who many of you may remember, was a great teacher at MGH. Really wanted to go into general surgery, and I told him I was going to become an otolaryngologist. He was so disappointed. And he said, you can go into otolaryngology, but don't go into it at Mass Ioneer. I'm like, why? He's like, you know what they call that place? The Cerumen Palace. I was like, what? So I was like, head and neck is not even in the name. And he was right. It was the Department of Otology and Laryngology. So here's this schlub from Detroit, that's me, if you couldn't tell, trying to decide, I had a passion for head and neck surgery. I had a horrible, and still have a horrible, imposter syndrome, which to this day I'm still trying to overcome. But I was drawn to surgery as a career, and really my passion was head, neck, and reconstructive surgery. So I tried to decide, was this going to be a good residency for me, and what is the history of head and neck in this organization, and why is it called the Department of Otology and Laryngology? It's changed, but when I was applying, that was the name. So I went back to history, actually, to try to figure this out. So this is fascinating history. You know, Mass Eye and Ear, as you all know, was founded on October 1st, 1824. The population of Boston then was 55,000. There were only 62 doctors in Boston at that time. And the only hospital that took care of patients at all was, let me try to see, is this a pointer? Oh, good. So it was this Boston Almshouse. It was opened up in 1662, and it's pretty prime real estate at the corner of Beacon and Park. And it was so bad that the mayor of Boston, Josiah Quincy, called it gross and disgusting in character, an incongruous and unfit mixture of a hospital, almshouse, and house of correction. So that's what it was. There was a hospital, basically a homeless shelter, and a prison. And that's where patients were taken care of. So these gentlemen decided that they were going to create this charitable hospital. So from its inception, Mass Eye and Ear Charitable Hospital focused exclusively on disorders of the ear, oral disorders. In fact, the first time that the word throat appeared in Mass Eye and Ear history was in the board minutes in February 6, 1883. So the dean then of the medical school said, would you guys like to take over throat disorders at Mass Eye and Ear? So they took it under advisement, and Doctors Blake and Shaw came back a month later, and this was their quote. The committee appointed at the last meeting considered this proposal and all persons suffering from the diseases of the throat coming to the Mass Eye and Ear, and this was deemed inexpedient, and the committee was discharged. So they washed their hands of throat disorders. So 1824 till 1883, zero. So what did that mean? That meant these disorders then went to a quintet of laryngologists who assumed the care of patients with throat disorders. And the leader of them, and these folks practiced primarily out of Boston City Hospital, which was still part of MGH at that time. I'm sorry, Harvard at the time, and MGH. And the lead was this guy, Ephraim Cutter, who essentially had 5 other individuals as well. And you have to remember, all of these guys, when they were all HMS graduates, but the tradition then was they all went to Europe to study with the famous laryngologists or oral surgeons in Europe. So this was the cadre: Cutter, Knight, Henry Hooper, Henry Kemble, Oliver. They all had 3 names. I don't know why. We should bring this back, and then Samuel Wood Langmaid. And Samuel Wood Langmaid is actually a particular interest because he was not even a trained laryngologist, but he had a nice voice. And he had this great tenor voice, and he was considered the first voice expert in Boston. And he was elected president of the ALA in 1891. Then in 1880, Harvard Medical School said, there's got to be laryngology training. So they established a course, and this was the first formal education in head and neck in the Harvard system. Again, not at Mass Eye and Ear, but with these individuals. And then finally, in 1895, laryngology was made compulsory for 4th-year students. So they were getting the head and neck training finally at the institution. Then a momentous thing happened. In 1906, a department of laryngology was created. It was at MGH. And Dr. Algernon Coolidge, and this is his book, Diseases of the Nose and Throat. Notice he left out ear, because that was over at MGH, over at Mass Eye and Ear. But Dr. Coolidge took over, And Mass Eye and Ear physicians, though, started to get the picture a little bit, because they're like, well, the ear is connected to the nasopharynx, the eustachian tube, the sinuses. It probably impacts the ear, so we better do some sinus surgery, some eustachian tube surgery, adenoids. So adjuncts to treating ear disorders were done at the Eye and Ear, but no throat, and certainly no cancer. And Dr. Coolidge added these individuals, most specifically, though, as we'll talk about, Harris, Peyton, Mosher. Coolidge was interesting because he developed the first bronchoscope. So those of you who were at the Russell Museum yesterday saw that box full of all these foreign bodies that were taken out with these bronchoscopes. It was pretty interesting. There was like marbles and dentures and pins and all kinds of stuff. They collected all this stuff, kind of like, you know, what we saw in the emergency room, removed from various cavities when we were junior individuals. But they collected these things, and that's what's in the Russell Museum right now. And Dr. Mosher joined that group. Now, this is an interesting point of history. Bill Roth developed the laryngectomy in 1873 over in Vienna. So these laryngologists started doing head and neck surgery laryngectomies at MGH. So in this, you know, 32-year period, they did 24 laryngectomies at MGH. The patients, as you can see here, were this age group, and they published this. And you can see that 12 patients just had trachs. 2 patients had no procedure at all. They just died of asphyxiation. And then the 10 laryngectomies they did, there was a 50% operative mortality, 30% recurred within 4 months, and only 20% were cured. So not a great track record. Maybe they should have, you know, moved it over to Mass Eye and Ear earlier. But this was the earliest publication about laryngeal cancer that came out of the Harvard system. Then, meanwhile, back at Mass Eye and Ear in 1906, this is who was on the staff. And I point out, and Stacy Gray and many others have held this position, the Walter Augustus Lecomte, Dr. Walter Augustus Lecomte was added to the faculty. He trained at Harvard Medical School, but unfortunately, and he also trained with Politzer in Vienna, but he died in 1907 of appendicitis at age 37. So his uncle gave $50,000 to create the professorship, which still to this day owes its name. So as you're looking for donations, Mark, could I give 50 grand and establish a chair, the Teknos chair? I think it may be a little bit more these days, but down payment. That's right, down payment. And Dr. Mosher joined the staff in 1905. And he was the first one who was a surgeon both at MGH and Mass Eye and Ear. Mosher graduated from Harvard Med in 86. He joined MGH in 1903. He joined Mass Eye and Ear in 1906. His great-grandmother was the sister of Paul Revere. So that's kind of an interesting thing. I don't know if you're going to mention that because I saw.
I don't need to give my talk anymore. You just did.
Are you serious? Oh, my God. I'm sorry, Ralph. He started this Mosher course, and he became, as Mark mentioned earlier, he actually created the American Board of Otolaryngology, and he held the position for 22 years. And then ultimately, he became the chair of laryngology at MGH in 1923. Again, it was at MGH. And then, this is when the Mass Eye and Ear formally became part of Harvard Medical School in 1921. This was taken out of a book that was written by the librarian at the Howe Library at Mass Eye and Ear, Charles Snyder. And you can see in May 3rd, 1921, this was a statement that was made. And it basically said, for the mutual benefit of the Mass Charitable Eye and Ear Infirmary and Harvard College, they should be associated for educational purposes. And it was voted unanimously that they joined HMS. So that's when we became a department. And as Mark said, Kazanjian joined in 1924. And then Mass Eye and Ear also joined forces with Mass General. And coincidentally with that, they dropped the name Charitable from Mass Eye and Ear. So maybe that had nothing to do with it when they joined MGH, but Charitable was dropped and it became just the Mass Eye and Ear. So for 100 years, Mass Eye and Ear really didn't take money from patients. It only after they joined MGH did they start doing that. Lucian Howe, actually, the Howe Library, he donated money to co-locate a clinic so that laryngology, ophthalmology, and otolaryngology could all be together. So that was the first co-located clinic. And then in 1928, the entire staff came over to Mass Pioneer. Harold Walker, this is an interesting bit of history too. And I don't know, Dr. Nadal, if you will agree with this or not. I don't think you got your chair like this, but Dr. Walker was the chief of the oral service at Mass Pioneer, and Dr. Mosher was chief of the laryngology service, and the dean said there should be one chair. So one Sunday morning, Mosher went to visit Walker, and he said, the dean wants there to be one chair, and he thinks we should resign and pick one chair. Only Walker resigned, and then they named Mosher chair. So, bit of a bait and switch, and then he remained chair until 1939, when Leroy Shaw will take over. Then, what I would argue is the glorious age of head and neck surgery at Mass Pioneer. These are the names, and some of the dates may be off, so I apologize, Drs. Waymuller and Cummings and others, because I got this from the pictures, not necessarily the actual years that people graduated. But just look at this illustrious name of head and neck surgeons that came from Mass Pioneer after that Mosher era. These are, Boyes was the chair at University of Minnesota. Converse, the father of facial plastic surgery. John Ballinger, the text that you all read. Danny Miller, you heard about. George Reed was a head and neck surgeon and the chair at Syracuse, who trained one of my mentors, Greg Wolf. Obviously Monty, who we all revere. James Snow, chair at Penn. Werner Chasen, chair at BU. Dr. Myers, of course, chair of the universe in head and neck surgery. Dr. Gross, we heard about at University of Virginia. Max Abramson, Dr. Cummings, dual chair. Dr. Spector at WashU. KJ Lee, who, he wasn't chair of head and neck surgery, but we all love KJ Lee because of his books and stories. Dr. Fabian, who taught us, Dr. Waymuller, the list goes on and on. And not only is it in head and neck surgery, but plastic surgery. And this famous Tom Musto story is he went on to become a plastic surgeon, but he's the guy who tackled a convict that actually did get out of the jail and made a citizen's arrest until the police came. And then I saw Mark Coltrera here. But ultimately, I left off with Mark Vivaros because that's where my story begins. And these are just pictures. I love these pictures. Look at this young, swashbuckling Dr. Cummings here. And Gershon Spector, Ed Jackson, you guys may remember Dr. Max Abramson, Dr. KJ Lee, just incredible talent. And look up here. That's a young Billy Joel. No, that's Dick Fabian. So just great history. And then when I arrived, this is the best of times. This was the Mass Pioneer faculty when I got here. Obviously, Dr. Nadal was our incredible chair. Mike McKenna, who was such a gifted surgeon and such a great teacher. Dr. Rausch, who was one of the best teachers as well that I'd ever had. And Sam Merchant, who had just joined and unfortunately passed away. We also had Dr. Vernick at the Longwood area. The pediatric service was Dr. Evie, who I know is here, and Mike Cunningham. The rhinologist, Ralph, you haven't changed a bit. He looks exactly the same as he did many, many years ago. And Dr. Solomon, the head and neck team, including over at, with Marshall and Marvin Freed. I know Dr. Freed, great mentors of mine. And then, of course, Steve Zeitel. So what an amazing group of surgeons that I got to meet and be part of. But really, I want to finish with Dr. John Faza. And I know he's come up a lot of times, but this is a man who does not get enough credit. So he was no doubt a beloved teacher. He was a master clinician. Who else could spend every single day in the emergency room dealing with Uganagan? He taught us twice a week. It was really our modern day Mosher course. He ordered the same pizza every day. One time, I know Howard Bowie's supposed to be here. Howard's like, we got to change this pepperoni pizza thing. So he called the upper crust restaurant. He said, give us salad and subs. And when they showed up, Dr. John, I've never seen him mad. He lost his freaking mind because the pizza didn't come in. And of course, we had pizza for the rest of our residency after that. He attended there. He also, as Richie mentioned, he was our attending for our minor procedures down in the emergency room. But he'd always try to find reasons to cancel the case. So he would ask people, how's your blood sugar? And he'd say, I don't know, we didn't check it. Cancel the case. He might have diabetes. The other thing he was petrified about was HIV. So we were in the throes of the HIV epidemic, so as we're doing procedures, he would ask 2 questions, though, and if the answer was affirmative, we were good to go. Number 1, are you married? And number 2, do you have a job, and what do you do for a living? As long as they were married and had a job, we were good to go. That was his HIV test. But my favorite was when he would walk into a room, nobody really figured out what this really was, but he would just go, hey, everything. Worked. It was amazing. But loved Dr. J. Everybody loved Dr. J. So I'm going to conclude by just saying, I did decide to come to Mass Eye and Ear. It was the best decision I ever made, and for many, many reasons. Week number 1 after I got here, I met my wife in the cafeteria at Mass Eye and Ear. That changed my life. Obviously, I would have been probably asleep under a bridge if I wouldn't have met her. But I met her here, which, we've been married now for 29 years and have 6 children. The training was exceptional. It got me fellowships. It got me opportunities. The mentorship was unbelievable. I mean, as has been mentioned by everybody, lifelong friendships were made. Forever grateful for the opportunity. But I do want to say, these 2 people are the people that shaped my life. I've had many mentors. Jim Netterville was my fellowship mentor, and Greg Wolf hired me. But these 2 folks, when I started residency, I wanted to be like them. I wanted to be like Monty because he could do anything. 1,000 acoustic neuromas, sinus surgery, cases that you're like, there's no way this is going to work. He would pull it off. Humble. I remember one time they asked him, there's some challenging case. It was grand rounds, and Dr. Nadal actually said to Monty, we have the world's expert on this. Monty, come on down and tell us about this. He comes down. He pulls up his pants, and he's like, this is a tough case. And he just went and sat down. And then Mark, what I saw in Mark was what I hoped to be. A Greek immigrant's kid who was good at what he did, who was just a good human being. I'm a crier. I mean, I love Mark Vivaris. He is my hero, and I'm forever grateful for Mass Eye and Ear for allowing me to be here. Thank you.